Welcome back, everybody, to Dr. Sellers Educate. We're happy that you're here as you continue on your journey towards achieving CNE success. If you haven't already, go ahead and subscribe to this channel so every single time there's a new episode, you'll be notified right away. We normally launch a new episode every single week. This helps keep you focused as you move forward on your journey. Whether your journey is 7 weeks, as recommended by us, you can follow that 7-week study plan. And that description and connection to that 7-week study plan is right here in this episode detail. But you can also map out a 6-month study plan. We want to make sure that you are following the best strategies using the evidence-based practices that we go over in every single episode to help you close your knowledge gap so you can achieve success on the CNE exam. We are launching now a new series where we're going to be focusing on the role of the clinical faculty and what our responsibilities are, whether we are on the journey for CNE, CNECL, or CNE novice. Each of those certifications require that we have knowledge and are able to apply the concepts that we're going to be talking through over the next several weeks to ensure that we are validating our level of competency that is outlined by NLN. All right, so if you want to go ahead and pull out your resources, we are going to be using Dr. Billings and Halstead's Teaching and Nursing, the 6th edition, as well as your study worksheet. All right, so those are the 2 resources I want to make sure that you pull out every single time that you join us for our episodes. Nursing faculty role in alignment with the academic program. We must first understand what the roles and responsibilities are for us in our role before we can really validate on the exam that we are knowledgeable and have an advanced level of competency that's required for us to be successful on the CNE exam. We are excited to welcome Dr. McMillan Bowler and Dr. Jetzig Neiman on August the 11th at 12 noon Eastern. Now, if you're watching this episode and that date has passed, you still have access to the recording. So we want you to join us. If you have not registered for this session already, we want you to do that right away. They're going to be focusing on the important role of enhancing clinical judgment and application for the social determinants of health through storytelling. We know that storytelling is an art and a science, and they're going to explain some of the key concepts associated with the work that they're doing and advancing related to the curriculum and ultimately improving patient outcomes. So let's take a look at our thought-provoking question. The clinical teaching role of the nurse educator encompasses guidance, support, stimulation, and facilitation of learning in the range of practice settings. What strategies are most effective for the nursing clinical faculty to help bridge the gap between theory and practice in nursing education? A is by reducing the clinical hours required for students. B, by emphasizing theoretical lectures over clinical experiences. C, by integrating real-life patient scenarios into the curriculum, or D, by limiting the use of stimulation in the classroom. So think about content that you're already knowledgeable about. Be clear about what that question is asking, and then I want you to go ahead and jot down on your study worksheet what you think the best choice is. We're going to start these series looking at Tanner's clinical judgment model. You want to go ahead and print out this resource if you are not familiar with Tanner's clinical judgment model. Okay, we do encourage you to do that if you have at least 7 weeks. If you are within 2 to 3 weeks of taking the exam, we do not want you to print out the article, okay? Or if you're just here as a refresher to reiterate some of the gaps that you may have regarding the clinical judgment model or the clinical faculty role, then certainly we want you to print out this resource. There are 4 phases of the model that we're going to talk about in this episode as a good overview. They include noticing, interpreting, responding, and reflecting. But let's go back and talk a little bit about what is the purpose of Tanner's clinical judgment model. Why is there so much interest and really expectation around this model when it comes to integrating it into our curriculum? Well, the reason why is because we know there are still lots of errors that occur at the bedside, and it can lead to patient harm. I will share with you that there's one critical situation that was brought to my attention just a couple of weeks ago, and it was related to a patient fall. What we know about falls is that there's still fatal injuries that results from falls, and that it is continuing to cost our healthcare organizations millions of dollars every year. Well, we have talked about with this group a root cause analysis. So what really led to the fall? Was there human error involved? Are there policies that were not followed? Are there policies that we need to add or revise to ensure that the faculty and the staff have the guidance they need of how to prevent falls? Okay, so as a nursing faculty member, we want to be knowledgeable about the evidence and any strategies that we can put in place, even to recommend to our healthcare partners about practice changes that we can make to improve the overall quality of patient care. So when we have patient care situations, whether they're basic or complex, we want to be able as a clinical faculty member to pull from Tanner's clinical judgment model to help reiterate or to perhaps introduce clinical concepts that are going to help students make the best decisions to provide safe patient care. And we want to use the evidence to do that. So what are some of the strategies that are associated with each phase of the model? First phase is going to be noticing. Okay, so that falls under the category of being clear about expectations, providing context, background, and relationships, thinking about that concept map with our students. So this is a situation where we could be in the classroom going over what is required for care of the heart failure patient. It could be in a clinical setting where the nursing student is observing the the nursing practice of the clinicians in their environment. The next phase is interpreting. So the nursing student is going to think about what are the analytical components associated with the care of the heart failure patient. So what is the definition of heart failure? What type of medications are given? What type of assessment do I expect to find when I am listening to heart sounds, listening to lung sounds, when I'm checking the pulses and the swelling for a heart failure patient? And then the next phase is responding. So they're taking an action based on the information that they have gathered during the noticing phase, during the interpreting. And another component of the interpreting phase is going to be blood work, right? So what's the blood work that was captured? What are the vital signs? And then they're going to take action, and they're going to think about outcomes. How did the patient respond? And then that next phase is going to be reflecting, where they're thinking about what worked and what didn't work. Our responsibility as a nursing faculty is to ensure that we are preparing our nursing students for the next phase of their career. We want to ensure there's alignment, and ultimately we have good matriculation rates, that students are progressing in our program, that they're being successful, and that they are well prepared to be successful on the NCLEX, and ultimately to make safe patient care decisions at the bedside. As clinical faculty, we want to work with our didactic faculty to ensure there's curriculum alignment. And as much as we can, we know that it can be challenging. We want to ensure that we are aligning the content that we're reviewing in our classroom with the actual clinical experiences. We want to allow students time to reflect on those clinical experiences, perhaps even having discussions in the classroom setting to help students close their knowledge gaps. All right, so if you chose C, by integrating real life patient scenarios into the curriculum, you are correct. Bridging this theory to practice gap helps scaffold our students' learning so they can advance those critical clinical judgment skills. If this is a muddy point for you, make sure you review Chapter 18 in Billings and Halstead. Until next time, we hope to see you during our 9th session for our summer series. Reach out to us if you have questions, info@drsellerseducate.com. We'll see you next time. Have a great one, everybody. Bye-bye.